Welcome to the Dare to be Ready podcast. We have an exciting episode for you today. We're going to introduce a tool to you, teach you how to use it. It's a readiness planner tool, and we have all the right people to help us do that. So, and we'll be led by James Lipshaw today, as always. Hello, James.
Hey, Chris.
We have a special guest, Henrique from Brazil, with us today. Welcome, Doctor.
Hello, Chris and James. It's a pleasure to be here.
Today, we're going to give you a tool that Henrique came up with the idea for this tool. He called me up one day and he said, Chris, we should code up an AI tool that helps people make readiness plans. And I said, well, that sounds good. How do we do that? And he made a draft of it and sent it over. And that was a big moment. And Henrique, how long ago was that?
Oh, I think 5 months.
So we made that first draft of the plan. We instantly started to use it. And then we started to use it, in our own hospitals. And I started to use it with many different customers and students and across many different applications. And it's just been so incredibly useful. And then James, I'll throw it to you here. You came up with the idea for us to have a quick podcast episode.
Yeah, the thing that got me really excited when I saw the work that you and Henrique were doing was that I think a lot like the way we think about readiness planning, which is you really have to partner with the teams that you are working with to understand what is it that they don't feel ready for in their day-to-day work, and then come up with training and solutions that can help them get ready for those moments, as opposed to having this pre-built training that you just impose from the top down on people that they maybe don't really care about or maybe doesn't really help them get where they feel like they need to go. I think AI tools are the exact same way, is that often we will get some sort of mandate from administration that says you need to implement this AI tool in this specific way, or you need to use it in some way. Here, we paid for this tool, like figure out how it's going to work for you.
Yeah.
This build is totally different from that. What this is people who needed to make these plans, people who need to design trainings that are effective for their teams, can now use this to bridge the gap between like, okay, we need a plan. How do we do that? How do we do the training? And so again, like the readiness plans themselves, this was made in conjunction with teams who need to be ready to get their people ready, as opposed to being something that's mandated from the top down. And I'm just really excited because I think it's really, really useful, unlike a lot of AI tools that you see.
Great. And here we are. So what I'll do is I'll start in with a case. Now, this particular AI tool is a Google Gemini gem. And that's where Henrique built the first version, and we've kept refining it, and we've really appreciated the functionality of Google Gemini as we've done this. This is not an advertisement. You could build something similar in a number of different AI platforms. I'm just in my Google account here, and on the left-hand side, it lists the gems that I've built or that I have access to, and I'm going to go ahead and click on the Readiness Planner. Now, we are going to give you, as part of this podcast, a link to the gem so that you can get to it, and also we'll direct you to our website where you can get the link to the gem as well. Okay, so here we are. We're at the Readiness Planner 2.0. Again, we've been through some versions. I'm going to first say hi, and you do need to type something to get started with it. Okay, and it welcomes you to the Readiness Planner, and it says, how can I help to improve your team's readiness today? And then as part of the prompt, it says, usually we start by identifying a situational vulnerability, something that happens that makes the team feel uneasy or less than prepared sometimes. It gives you a little bit of an example. Our team worries about pediatric patients arriving at the emergency room because we feel more qualified for adult patients. That's one I've heard many times. So now it's asking me if I have a specific concern in mind, or if it wants it to provide more examples. Well, I do have one in mind, and I got it ready. Okay, so what I said here is our new nurses need to be ready to give training to newly diagnosed type 1 diabetes patients upon or approaching discharge, including training for insulin administration, monitoring, and diet management. And James, how does that prompt sound to you?
It sounds good.
Okay, so let's give it a shot. And I'm using the fast setting for the AI, not the deep thinking one. And it says, okay, we usually start by identifying a situational vulnerability. So I mentioned unit-based nurses. Are there others involved? Focuses on T1D, discharge education. Is there a specific patient population? Is this happening primarily at the bedside or a specific discharge lounge? Okay.
Yeah, I think in question one, having dietitians at this point is very common as part of this educational training.
Okay. Let's include dietitians as well. This is with, let's say it's with adults. Okay, so here's the situational readiness need. Unit-based nurses and dietitians, adult type 1 diabetes discharge education in the discharge area, according to ADA guidelines. Okay, so here is the readiness plan that the tool produces. Okay, it's the title, Continuous Readiness Plan for Nurses and Dietitians, T1D discharge training at the discharge area according to ADA standards. Now, if we look at the plan, what we can see first is the middle of the readiness plan. Let's go to that, column 2. We see the situational readiness needs. That's the core of the plan. In our core scenario that these people need to be ready for is ready to provide comprehensive T1D discharge to a newly diagnosed adult, assuring they can self-manage insulin and diet independently. Okay, so there's our primary readiness needs, situationally speaking. And then what we have is a variation, and the word degraded says it's harder. This is more difficult. It's a more difficult context. So they need to be ready to provide effective education to a patient with low health literacy or high anxiety who is being discharged earlier than expected. That's just one example, James and Henrique, of a variation of the core. Okay, and we could also imagine others, but the tool has suggested one for us. To the left of that middle column is column 1. Those are the individual skill readiness needs that the tool is suggesting might go in that first column as a first pass. Okay, so specific insulin drawing and injection techniques, explaining carbohydrate counting, being specifically ready to use teach back methods with patients as they're understanding things or not. Okay, troubleshooting insulin pumps and other equipment, so on and so forth. Okay, so it's suggesting a number of individual skills. Now, important note here, this is not the be all and end all of the readiness plan. The tool gives you a first draft, and really the idea here is you take that first draft out of the tool, you put it into a document, and you edit it yourself and develop it with experts. Okay, but this tool is getting us started.
Chris,
Yes.
let me jump in. And I think if it's necessary, you can add something. For example, in column 1, maybe I used to provide this kind of information for patients, and we have some printed papers, especially for hypoglycemia for patients. And sometimes you can have different types of methodologies. So if you have a different methodology, you need to adjust the skills necessary for your people to be ready to help the patients.
Yeah, great. So you can actually enter into the tool what your methodology is, what your standards are, and the tool will adjust that readiness plan and give it back to you. In column 3, you see continuous readiness routines, things that you can do, and the recommendation from our organization would be that you should do those things in order to keep the team ready or keep the people ready and improve their readiness over time. So in this case, debriefing after things happen, warming up the team each day, reminding the team what the priorities are related to discharge training, maybe having some mental rehearsals, having some get ready simulation programs of different types for the team.
So one thing that I would mention here, Chris, is just as a reminder, whenever we're using something like an LLM, an AI, a generative tool, is that these tools are by their nature normative in the sense that they push all context to the center of sort of a standard normed curve. And so the tool, when it is generating context around your readiness plans, may include things that would generally be true, are likely to be true across a very broad sample of contexts, but might not be specifically true in your context, or might lack something that is really critical in your context. So for me, I might imagine situational readiness needs or skill readiness for type 1 discharge training around resource access. Specifically, how do I get my medication? How do I afford my medication? If I'm unhoused, where are resources that I can access the things that I need because I can't go to the store and buy them?
Yeah.
And so I think that would be a really critical part of a lot of type 1 diabetes training, especially discharges that are happening in the ER or in a med surg unit. So that might be context you could add. Or if it adds it and you're like, in my community, this is not specifically an issue, then you could remove it by saying, actually remove this context.
Great, James. And, I've found that the tool is extremely receptive to those adjustments. Say, oh, by the way, I'm not in a big hospital. I'm in a rural hospital. And it's the only hospital within 30 miles, and it will adapt your initial draft of the readiness plan accordingly. Let's summarize a bit here. So what we got was a first draft of a plan for describing a readiness need that nurses and dietitians, maybe dyads, need to be ready to train type 1 diabetes patients as they're about to go home from the hospital. And these are newly diagnosed diabetes patients headed home from the hospital. Really important training moment for that person's health, for that person's well-being, the well-being of their family unit, in addition to trying to prevent them kind of bouncing back to the hospital because they didn't understand something basic. And that's a major cost driver in the healthcare system, of course, and also inconvenience driver. It causes lots of angst for people all around. So we see the basic readiness plan here. And again, it has 3 elements. At the middle of the plan is the core situational readiness need. On the left-hand side are the individual skill sets that are needed, that the nurses need to be ready for. And then in the third column are things that you do to get ready and improve your readiness. Okay. Now, as you go down in the plan, and Henrique will give us a deeper version of this later, the readiness planning tool will offer to make a training plan for you. So can I see training plan? And it will think for a moment and then give you a training plan. And because we coded it, it uses some of our philosophies around how you divide up training into different training zones. And these are related to the sim zones or simulation zones of training that our organization works with. So if zone 0 is training that's self-driven without an instructor present. And so it'll give you recommendations for that. Zone 1, that's foundational skill instruction with an instructor. So it'll give you basic recommendations for that. Zone 2 is situational practice and training using simulation, gives you those recommendations, and so on and so forth. Right down to real world, everyday learning using reflection and debriefing. Now, if it initially gives you kind of basic training recommendations, you can ask it for a much deeper and more detailed training plan if you like. So what I think would be a great idea now is to move into a real world plan. And Henrique had something to do. He used the tool to do it, and we'll tell you that story now.
First, I'd like to talk about the idea of the AI agent, because when I started using the readiness plan in our hospital, it seems to me people had difficult because they were new to the concept, and sometimes they struggled a little bit to create the 3 columns. So the idea was, why we don't have a AI tool to help them to start the process, and after that they can refine with the teams, and it will be easier to use the tool, and it's more prone to have people ready to go in our hostel. So this was the idea behind the Gemini, the gem we created. So something I want to add is, if you're not used to use this kind of tool, your prompt will be better and better as you go. So sometimes you start using just small prompts, and after that you start how to improve your ability. So as you go, you are becoming more skillful in doing this. So in our case, we had a situation, is a new hostel in Araguari, Minas Gerais, which is a city with 100,000 inhabitants. And we had some difficult case with a violent patient, and during the process, I felt that we had some difficulties for employees to deal with this situation, the right way to do this. So the idea was to create a protocol we called the Code White to help them to do what's necessary to try to de-escalate the emotion of the patient at that moment. So we started the Readiness Planner with the situational vulnerability. In this case, it was about healthcare and administrative employees feel insecure when they have to handle a patient violent or a family member before the arrival of a specialist team or a security team. So this was the kickoff of this Readiness Planner. So after that, Chris showed in the first example the fluence of this AI tool. And we had some questions about who, the situational domain, where, and the quality level. So at this point, I like to answer using 1, 2, 3, 4 to interact more easily. So who, healthcare and administrative employees, situational domain, primarily about the verbal de-escalation, physical safety, and specific protocols for calling the specialist team, where main lobby, emergency department, and wards, etc. And the quality maintains safety and following the de-escalation protocol. So after that, it created the draft. So we have the 3 columns, and in column 2, the core scenario, as Chris mentioned, is ready to maintain a safe environment and use verbal de-escalation for a frustrated family member in the lobby until our team arrives. So in this case, if I don't agree with the core scenario, I can interact with the AI. Oh, I want to change the core scenario. So this is the way we use, and we have most of the tool. And after that, we will have a very robust draft, and we go to different colleagues and peers to validate this readiness plan. So in our case, we created this readiness plan, and after that, I started to collecting feedback and inputs from different parts of the hospital. So I went to the security team, the chief of the security team, and look, we have this new protocol and I need your help and your feedback. And so he provided me the feedback, and I went to healthcare employees who are in the front line and I asked them feedback. I asked the feedback from Chris here because he's from another country. So sometimes they have different techniques or ideas for dealing with this problem, which is universal. So all over the world, we have this kind of situation, unfortunately. So after that, we had this readiness plan. We started to create the protocol and the training system. So as we interacted with the tool, it provides us something that we added in this second version, which is a script for mental rehearsal. So at this point in the hospital, we have Circle Up implemented in our hospital. And our idea, Chris and my idea, is to use the mental rehearsal as a tool for teams, not only to train a specific topic, but also for using in the daily routine. So I started a project in the neonatal ICU. So I scripted a very short mental rehearsal about the Code White, and they are using in the different shifts. And my idea is to collect the impressions to see how it landed to the teams and how it was for the facilitator. If it works, my idea is to spread the mental rehearsal for the other units. And it can be a way to spread easily the protocol or something we need. And it can be a way of the team to have this skill to, oh, we will receive a new patient. Let's have a minute mental rehearsal for this different case, or this is very urgent or difficult case. So Yeah, and after that, we have the sim zones training pathway. And in this case, I asked it to create a zone 2 scenario simulation, and it provided a script, and we can have like a deep conversation. I need to change this. I want to add this part or remove this, remove that. And when you interact with the tool, after that, it suggests to me, oh, would you like to have some zone 1 skills? Yes. So sometimes the tool provides you the next step. Sometimes it's a good idea to follow the suggestions. Sometimes, no, I need another thing. So this is the way I think it's more useful using this tool. And as you use more, you are more familiar with the agent, and it's becoming easier and easier to use it.
And then were you able to actually feed the final plan back into the tool? Is that something that you do or that you can do?
Yeah.
Okay.
Thank you for remind me this.
Yeah.
As you have the final protocol, you can upload in the tool and ask for design in the training system, and it will use the SimZone based system, and it can grab the main informations of the protocol and create a more specific training system for you.
Yeah, and I just want to reemphasize again that it's not just you type in the problem you're having and it spits out a plan and you're done. You have to bring it to people, get feedback from them, make sure that it's solving the problems that they need, make sure that it has the perspectives that you may not see. And one thing I also wanted to note that we sort of glossed over was that the tool suggests metrics for your trainings, because that's really critical anytime you're doing a training, to know how you're going to measure what you're doing before you start, rather than trying to figure it out afterwards. And so the tool does suggest ways that you could measure the effectiveness of your trainings before you start doing the trainings.
We've gotten lots and lots of feedback on those metrics that are suggested, and we've coded the tool such that it's suggesting kind of relatable, implementable metrics. So people are reacting very, very well to the suggested metrics that they're being given by the tool. Okay, so as we recap here, there is a readiness planning tool available to you. We are making that tool available to the public. We are going to give you the link for that. Once you start using the tool, a little bit of a warning, it's very addictive. I actually heard from a partner yesterday that they were using it and an hour went by really quickly because they created something like 20 different readiness plans for their hospital.
Yeah.
So it's pretty easy to dive into it. Now, it's exciting to learn to use the tool, but to James's point that he just made, once you know how to use the tool, go and work with your partners in the hospital, the people who work in those units, and build the readiness plans with those people and get the readiness plan out of the tool, and then craft it in real life with real experts. And you'll end up with wonderful, useful readiness plans that set you up to create training designs and team warm-up designs, team debriefing designs, mental rehearsal designs that naturally flow from that readiness plan once you've built it. And that is the purpose of this tool.
Yeah, and don't forget, you have the critical thinking. So the tool provides you a feedback and a draft, and you have to use the critical thinking, and you have to have the peers involved in this project. Otherwise, it will be, as James mentioned, a top-down protocol, and it's less effective than, oh, we have this problem, oh, let's adjust this or that part of the training. It's very important.
Okay, we want to thank Henrique for coming to us all the way from Brazil. You're a great leader at your hospital and in the medical school that you're faculty at, and that you're a leader at, and your work with simulation and applied learning every day in the hospital is really brilliant. Thank you for contributing your expertise today and to the tool. And to James, thank you for guiding us as always, and for the idea for this podcast. We are always interested in your feedback. This idea of being ready for what encounters us and what we encounter in the healthcare system, we're realizing it's a lifelong endeavor. So let's keep talking.
Thank you so much. It was a great pleasure to be with you.